I want to announce today our new cases and to let you know that we do have 8 actually new cases within the last day who tested positive for this. This is not surprising to us, and I'll go through in a little bit more detail why. The first 4 of these cases are actually household contacts of a case that we announced last week, and they had been under observation and monitoring, and they developed their symptoms while in isolation, so that's not unexpected for us. We knew that these were close contacts. The other 4 cases have no connection to any previous cases. 2 of these are individuals who have returned from recent travel to Iran, and both of them developed symptoms, and both of them have tested positive. And that's a woman in her 50s and a man in his 60s, and they reside in the same household. The other 2 are different for us. One of them is a resident of Seattle who is up here visiting family in the Fraser Health region and was tested positive on her visit here. So clearly that is of concern with us, and we are working with our neighbors to the south in Washington State to try and determine where her exposure might have been. And the last case is one that was picked up with our ongoing surveillance that we are doing with influenza surveillance that we talked about, where we are doing extra testing of anybody who's being tested for influenza. She has not recently traveled and has no known contact with any of our known cases of COVID-19. So that is something that we're paying a lot of attention to, of course. She's in the Vancouver Coastal Health region, and there's a detailed ongoing public health investigation that was started as soon as we found out about her positive case.
When a case is determined positive, we start an investigation immediately of contacts around that case. Sometimes those contacts involve talking to groups or institutions, and so information about that gets out before we announce it here. But in fact, that's the process, which is to engage with people in every single case, and that includes the cases where we're seeking more information now. Involves an investigation so that we can do everything we can to contain the spread of COVID-19.